Last month, a patient walked into Rochester General Hospital with, among other things, the first documented case in upstate New York for rare and dangerous fungal infection. Medical leaders say because they knew what they were looking for, the infection was quickly contained. Our news reporter, Christina Dominguez, was at RGH and spoke to those leaders about what they say worked.
We are looking at bacterial cultures on patient samples that we receive into the laboratory.
This is the microbiology lab at Rochester General Hospital. Every day, lab technicians here help doctors diagnose what is making patients sick. And it was here that 32-year lab veteran Sharon Firth spotted the first case of Candida auris in upstate New York. All the other cases in the state were in New York City.
New York State gave us some information that if you have identified a yeast that looks like this and acts like this and is identified like this, you should be aware that it could be this Candida auris. So we contacted our infection prevention team, our infectious disease docs, and got the ball rolling.
Candida auris is sometimes a fatal fungal infection resistant to most antifungal drugs. Patients with compromised immune systems, the elderly and very young, are most vulnerable. This superbug is also especially dangerous because it can live for long periods of time on hospital surfaces. Infection Prevention Director Melissa Bronstein said the patient, who had recently moved to Rochester from the New York City area, came to RGH in early March with symptoms of sepsis. The patient underwent a battery of tests, and that's when Sharon found the first signs of Candida auris, later confirmed in state tests. The hospital says it immediately began its containment procedures. The patient, who at first had a roommate, was isolated. Everyone going in and out of the room was ordered to follow strict hand-washing procedures and wear gowns and gloves. Bronstein says they tested all the patients in the unit and surfaces in and around the room. The only positive test results came back where they expected it, on the patient and in the room.
The routine cleaning products that we use are sporicidal, and that's the agent that's recommended for this fungal infection as well. So our routine cleaning was already in good shape to keep us protected from this organism, even when we didn't know the patient had it. And our hand hygiene compliance, that's something that we work on every day, and we do a lot of training with our staff to be sure that our hand hygiene compliance remains high.
RGH says that when a case of Candida auris was confirmed here, as part of standard practice, it shared that information with other specialists in Rochester. It's expected that there could soon be other cases in the area, and RGH wanted to share what it did to contain the spread.
Bronstein says the patient at RGH later died from several complex medical issues. Tests done a month after the patient was first admitted showed no signs of the deadly fungus anywhere.
We need to not assume this will be the last case, so we need to be ever vigilant.
Christina Dominguez, Spectrum News.